I'm Shannon. I'm your dietitian today. I'm just here to talk to you about your eating habits and your lifestyle. Yeah, what brings you in here today?
Well, I didn't really want to come in, but I was referred from my doctor. He's been trying to get me here for like years and years, but I'm so busy that it's really hard. And my kids, they're kind of nagging on me too, so I finally came.
It's important to listen to your patient's reasons for coming in to see you. Their reasons can be a great motivator when making changes. In this case, the patient's reason is that her family wanted her to be healthier. Here is an example of motivational interviewing.
Good. Well, I'm glad to hear. It sounds like there's a lot of people that want the best for you and want to see you make some healthy changes. So I'm here to help you out.
Every patient is different and should be treated as such. Listening to their responses can create trust and a good relationship between you and the patient.
So tell me a little bit more about yourself, like your daily life, what you deal with, and a little bit about your diet too.
Okay, so I live in a pretty rural area. I mean, it took me about 2 hours to just get here, which is kind of the reason I didn't really want to come here in the first place. And I only go to the grocery store once a month, and I just try to stock up because I know I'm not going to have time. Like every day I'm doing something different. So I don't buy a lot of vegetables because I don't know what I'm going to do with them. Like I know they're just going to rot in my fridge. So I get a lot of the food I get is from the local food pantry, and then also the meat that I eat, I just raise myself. So that's a lot cheaper option for me.
The choices a patient makes can result from multiple different factors. These factors are the social determinants of health. These determinants include food availability, habits, environment, health status, education, and genetics. For example, our patient raises her own meat, but has a low access to other foods. These determinants make it hard for her to eat other foods like fruits, vegetables, and whole grains.
Going off of your diet, I have some information here that your doctor sent me when you got the referral to a dietitian, and it says here that you have hyperlipidemia. Do you know what that means, or have you heard of that before at all?
When explaining health topics to your patients, make sure to use familiar words. There is nothing scarier than going to a doctor's office and they are using words like hyperlipidemia. Most people do not know or use these words in their everyday vocabulary, and that's okay.
No, I don't know.
No? Okay, that's okay. No worries. It's like a medical term that basically says that you're at a higher risk for heart disease and stroke. I have an idea to help your hyperlipidemia would be to change your diet a little bit, and specifically to cut out all the red meat that you eat in your diet.
Okay, I can maybe try that.
Okay, yeah, so that would be all the red meat that you eat, so hamburger and other meat items that you have. And I would advise that you do that almost every single day. So on a scale of 1 to 10, how willing are you to do that?
All the meals that I eat?
All the meals to get rid of the red meat.
Probably a 1.
A 1?
When making goals or recommendations with your patient, it's important to remember their social determinants of health and give ideas that are achievable. A tough goal puts the patient at a pre-contemplative stage of change. Understanding the stages of change will be useful in determining goals for a patient.
So we can start a little bit slower if you would like. Maybe just try to cut out 1 serving of red meat, one day a week. Would that be easier for you?
Yes, definitely.
Yeah? Okay, so on a scale of 1 to 10, how willing would you be to cut out 1 serving of red meat a week?
Probably 10.
A 10.
Changes are much easier to follow when completed slowly. Considering her social determinants of health, her setting, her food availability, and her activity level will give you the best tools to help you with her dietary changes. This is called the social economic model, meaning that every patient has a different background to consider for achieving the greatest health outcome. The social economic model is also a part of motivational interviewing. Understanding your patient and giving them compassion are a few motivators to facilitate change. An easier goal will put the patient at a preparation stage, which means as such, the patient is preparing for change.
Well, I started off with the red meat because specifically there's a diet out there, more of a style of eating called the Mediterranean diet. So that includes more vegetables and whole grains and other meats that aren't red meat but still really viable options. Like fish is a really good one, even just like canned tuna, or salmon, that's also a really good one, and other lean meats like chicken and turkey. So like instead of the red meat that you are having and that one change that we agreed to make on, you could do like chicken, turkey.
The Mediterranean diet is a great way to reduce red meat intake and incorporate heart-healthy foods. Studies have shown that this easy-to-follow diet will reduce the risk of heart disease.
And then when we leave, you can follow me out, and I have tons of pamphlets that you can use with like information on where you can get food and like good options for storing it. So I think this will be a really great place to stop. Cool. Thank you so much for coming.
Yeah,
Let's
thank
go
you.
look at those pamphlets.
Hopefully, this video has shown you some great ways to be an active listener with your patient. A patient's social determinants of health will influence their readiness to change. Determining the patient's stage of change and using motivational interviewing will increase their health outcome and their autonomy for change.